Hello, welcome to another COVID-19 Law and Policy briefing produced by Public Health Law Watch, a George Consortium initiative housed at Northeastern University School of Law. Thank you to our co-sponsors, the Center for Public Health Law Research at Temple University, the Network for Public Health Law, and ChangeLab Solutions. We're here to provide expert legal analysis during the COVID-19 pandemic and hopefully to answer some of your questions. For more information on the legal response to COVID, please check out our report, the COVID-19 Policy Playbook at www.covid19policyplaybook.org. This is our final episode of our most recent series. Thank you so much to all of our guests and viewers for over this past year. If you'd like to watch previous episodes, you can do so at Public Health Law Watch website, www.publichealthlawwatch.org. I'm Sarah Guia, CEO of ChangeLab Solutions, a national nonprofit that uses the tools of law and policy to advance health equity. Joining me today are Sharon Terman, Director of the Work and Family Program and Senior Staff Attorney at Legal Aid at Work, and Danilo Trisi, Director of Policy and Inequality Research at the Center for Budget Policy and Priorities. Thank you both for being here today to talk about laws and policies that support children, families, and employees. So Sharon, I'd like to start with you since you were a contributing author to both versions of the COVID legal assessment. Can you share a little bit about the findings that you and your colleagues had around paid leave laws across the nation, or paid leave laws for employees, and some of the recommendations that you made, particularly during the COVID pandemic?
Yeah, absolutely. And first of all, thank you so much for having me. I think one of the things we really saw during this pandemic is that low income and BIPOC communities really bore the brunt of this crisis, both in terms of health and economic outcomes. And we know that these communities were already facing really stark inequities before we entered this crisis. And just, the pandemic just really exposed and intensified those inequities. And I think when it comes to paid leave, we knew that coming into the pandemic, Black and brown workers and low paid workers were much less likely to have access to paid leave, which really made it quite difficult for them to stay safe and to keep their families safe and to stay financially stable. The US, shockingly, is still the only wealthy country in the world that provides zero paid leave. And we've really seen over the past year how this lack of a care infrastructure has led to, really terrible outcomes, has led to a mass exodus of women, particularly women of color, from the workforce, undoing generations of gains in terms of labor force participation. And so, in terms of the federal response to all of this, actually last year in March, Congress did pass the very first ever national paid leave law to address the crisis. We know the law was hugely imperfect. It exempted tens of millions of workers, disproportionately many essential workers who were most likely to need its protections. And, that being said, even with those imperfections, we know it also made a difference, right? I mean, the research has shown paid leave saved lives. It helped curb the spread of the virus. It helped keep people, financially afloat. And yet Congress let it expire at the end of the year last year, at the height of the pandemic. And so, Congress did leave in place some temporary tax credits for employers who voluntarily chose to provide paid leave. But the reality is that at this moment, when COVID is surging again, millions of Americans really have no right to paid leave to stay home when they're sick, to care for ill loved ones, importantly, to get vaccinated. And so the bottom line is, the federal response really did, it helped avoid an even graver crisis, but there were major gaps in coverage, major barriers that actually worsened disparities. And we really do need bold action now to provide universal paid leave to protect the health and economic security of all Americans, especially those who are most impacted by the pandemic.
Thanks, Sharon. We'll get into a little bit more of what that may look like too in a minute. Danilo, I wanted to shift to you because your organization, I think you're one of the co-authors, just released a report that talked about some of the economic security programs and the role that they play in reducing racial and ethnic disparities. Can you share a little bit about what your colleagues have learned about those programs? We know they were really important during the pandemic as well to help families make sure that they had access to food and housing and other programs. So please share a little bit about your report and what you learned.
Yeah, so like Sharon said, the pandemic and economic fallout was widespread, but it was hard. Communities of color were hardest hit. One of the ways that we tracked how families were doing was looking at the share of adults that reported struggling to cover usual expenses. These expenses included paying for food, rent or mortgage, car payments, medical expenses, or student loans. And these are data that came from the Census Bureau that the Census Bureau started releasing in August of 2020. And we basically saw that the rates of adults reporting struggling to cover these usual expenses continued to increase all the way through in 2020, all the way through to December of 2020. And in December of 2020, 38% of adults reported that their household, that they were struggling to cover these usual expenses. That's over 80 million adults. So that's very sobering to think about, that there were this many amount of families and households that were having to make these tough choices. Should I pay the rent? Should I afford food? Should I pay for these other bills that were piling up? So as Sharon mentioned, the government response helped. Undoubtedly, the hardship rates would have been much higher without the government help. We did see that these rates dropped somewhat after the passage of the American Rescue Plan in March of 2021. But even the latest data is still shows widespread hardship. 28% of adults in the latest data that came out, that's for June, are reporting difficulty covering usual expenses. And then particularly for Black and Latino households, their rates are closer to 40%. So they're actually in June, they're where they were. The rest of the population was back in December. So that's really striking, but I think it just speaks to the inequities that existed even before the pandemic. We've also done some research, using data from before the pandemic, and it showed that 1 in 3 children live in a family that struggle to purchase food or shelter over a 3-year period. So 1 in 3 had trouble, and this was before the pandemic. So this is why we need a robust kind of government response now this year to kind of help us address these inequities that have long existed.
Well, that's actually the perfect pivot, because I'd like for both of you to talk a little bit about the responses from federal and state governments. I know we've talked about some of those programs. If you can kind of explore a little bit more of, like, since that time, since the Biden administration has come in, what are some of their recommendations or proposals that would be really helpful to children, families, and employees? And then Sharon, I'd like to invite you to speak to both the kind of federal and state level, because I know also states can take actions that are maybe a little bit more tailored to what their particular populations need. So Danilo, if you don't mind sharing a little bit at the federal level, what are some of the examples? And then Sharon, I'd love to hear from you about some of the examples around paid leave.
Sure. And to start, maybe I can highlight 2 policies that are included in the Biden administration's American Families Plan. The first one is the expansion of the child tax credit. So this week, families started receiving a monthly payment of $250 per child, age 6 to 17, and then $300 per child under the age of 6. About 90% of the nation's children will benefit from this expansion, and this has the potential to reduce child poverty by 40%. But unless Congress makes this permanent, these monthly deposits will stop in January of next year. So it's very crucial for Congress in this fall to extend that policy. Secondly, the Biden plan includes a permanent extension of the summer EBT program. Now, this was a program that was providing additional resources to families with children to afford to buy groceries to make up for the loss of in the school meals. And every year we see that food hardship among children goes up during the summer months because kids are not able to rely on those school meals. So this would be a permanent kind of policy change to address that, to provide additional resources to families during those summer months. And we know from lots of research that these economic security programs, by reducing hardship for children now, it helps them do better in school, and it will help them have better opportunities in the long term, right? To be healthier and to earn more as adults. So these programs are really investments in our collective future.
Yeah, and I'll just say that on paid leave, the administration's response has been really twofold. I think first, I already mentioned these voluntary tax credits, and President Biden has extended and expanded those tax credits, for example, to allow them to be used to cover expenses for leave to get the vaccine. So that's good, but it's still voluntary. And so still millions of Americans are left out of the ability to take that leave. At the same time, the administration is also proposing, as part of the American Families Plan, permanent, comprehensive paid family and medical leave on the federal level, which would allow workers to take paid leave when they're seriously ill, when they're caring for a seriously ill family member, when they're bonding with a new child, to deal with a family member's overseas military deployment, for domestic and sexual violence related reasons, and also bereavement leave. So that plan would actually be phased in over 10 years, which really speaks to the need for states and localities to step up and fill the gaps in the meantime. But it is also exciting that paid leave on the federal level is finally on the horizon, which is actually very long overdue. At the same time, President Biden is also supporting a number of other, and has endorsed a number of other really key proposals to support workers. So an increase in the minimum wage, paid sick days, Pregnant Workers Fairness Act to ensure that pregnant workers are not pushed out of their jobs, the PRO Act to strengthen unions and worker organizing, the Paycheck Fairness Act to close the gender pay gap, and much more. And so I think that really, all of these proposals would go a long way in combination with state action to ensure equity and health and stability for families.
You both speak to a really important point, which is that many of the disparities that we saw exacerbated in COVID-19 were actually there beforehand, right? So we already saw disproportionately that Black and Brown communities were affected or didn't have the same kinds of employee protections. Danilo, you spoke to, poverty rates among children, for example. What do we need to do? And these are all really important policies as we move forward that I think will help to address those and are very much needed. What are the other kinds of structural issues or additional policies that we could look to address these kinds of structural challenges that we're seeing, and that particularly put equity really at the forefront in terms of trying to level the playing field among some of the families and workers who are most impacted by these health disparities?
So maybe I can start. I think that's totally right. I think Congress really has a historic opportunity to kind of help us advance racial equity and to really invest in communities that have been underinvested for so long. One area that we haven't talked about yet is kind of housing affordability. So we need to make sure that we need to do more to make sure that housing is more affordable for more families. So one way to do this is to sharply expand housing vouchers. Right now, due to inadequate funding, just 1 in 4 eligible families receive any federal and rent assistance, and there's long waiting lists. So we should address that. Also, we need to move towards the goal of universal health coverage. An important step towards that would be to close the Medicaid coverage gap. Right now, 2.2 million adults don't have a health insurance because of this gap. That's the majority of those adults are adults of color, and they don't afford, they don't have health insurance because they are in states that where they're not eligible for Medicaid, and they don't have, their incomes are too low to be able to get subsidies in the affordable, in the ACA marketplace. Also, we should think about access to benefits by immigrants, and you know, 1 in 4 children have an immigrant, at least one immigrant parent. These kids are part of our future, but they don't have the equal access to a lot of the benefits that we've been talking about. So we should find ways to make sure that they really have an equal shot at success. And lastly, I'll mention that we should also think about people that live in U.S. territories. Right now, you know, poverty rates are higher in a lot of the U.S. territories, but they don't have access to a lot of the same programs that we talked about today. So an important step would be, for example, for Medicaid funding to be more adequate and long-lasting for people living in the U.S. territories.
With all of that, and I think in addition to all of the policies we've talked about, I think a couple other ones that come to mind are, you know, really improving the unemployment insurance system, which we saw was not equipped to handle a crisis of this scale. Another really big issue for low-paid workers and many workers of color is lack of stability in their schedules, lack of control over their schedules, unpredictability. We, you know, with a lot of workers get basically no advance notice of their schedules, which makes it impossible to plan for caregiving and medical appointments and schooling. So, and we know that, you know, there were inequities during the pandemic where, you know, higher paid or more privileged workers were able to work from home, right? And which made it much easier for them to juggle childcare, but low paid workers often don't have any flexibility over, you know, where and when they work. And so we need to deal with that, ensure more advance notice schedules, more accommodations for caregiving. And I think kind of going back to paid leave for a moment, I want to speak a little bit about just the importance of when we're designing these policies. You know, it's really critical that we center the needs of the most marginalized workers. So, you know, we know, for example, from our experience in California that there are certain policy elements that are really vital to ensuring that we are going to reduce racial disparities. And so things like ensuring the leave is job protected, ensuring that the wage replacement rate is high enough, particularly for low wage workers, making sure there's an inclusive family definition. And then even beyond what the law says, we also really need to focus on implementation and outreach. So like people, we need to ensure that we're doing enough, investing enough in effective community-based outreach via trusted messengers so that people in their own language can get information and get help navigating these programs, because we're talking about people who are undergoing very stressful life events, right? They're dealing with a serious illness or a new child entering the home. And so we need to design these systems in a way that is easy for folks to access these benefits. So I think, you know, just we have to, as we think about all of these wonderful policies, I just wanted to highlight just the importance of not only getting the policy details right, but making sure it's working for folks on the ground.
Yeah, thank you for lifting that up, Sharon. I think we definitely, I feel like we learned over this past year that, you know, there was great intentions for some of our policies and programs, and yet we're still seeing, you know, money hasn't gone out, or, you know, communities still don't know about the services or the benefits. Oftentimes it's limited English proficient individuals or individuals who just don't have as much of that contact with, you know, programs and services. And so using those trusted community service providers is one of the things that we've definitely learned. And there's a plethora of recommendations out there. We know what we need to do. And I think we just need to make sure that we're partnering with our policymakers and sharing those recommendations and information to be able to take action in this time of need. I really want to thank you both so much for taking the time. Just open it up for any closing comments or thoughts before we say our goodbyes.
Yeah, no, thank you for the opportunity to talk about these issues. And as we said, you know, this year, Congress really has a historic opportunity to make a difference in a lot of these areas, and really invest in communities that we've underinvested for too long.
Yeah, thank you so much for inviting me to be a part of this important conversation. And I'm excited about this opportunity to, invest in the communities most impacted by the pandemic, and to ensure we all stay healthy and can weather the next crisis. So thank you so much.
Well, thank you again to my guests, and thanks to all of you for listening today. Again, recordings are available on the Public Health Law Watch website, and the shows are archived by the Week in Health Law podcast at www.twihl.com. The COVID legal and policy briefings are produced by Faith Cowlick and Bethany Saxon. We'll see you next time. Please stay safe.